Good morning, everyone, and thank you for joining us. Welcome to BCRPU's 2021 webinar series. Today, our speakers are Mr. Bryan Melnyk and Ms. Sharon White. Sharon White is a senior consultant for the BC Government Sport Branch, Ministry of Tourism, Arts, Culture and Sport, and is involved in a number of federal, provincial, and territorial safe sport work groups and initiatives. She attained her Bachelor of Fine Arts with a journalism major at the University of British Columbia. As a former Ironman competitor and Canadian Football Association referee, long-distance cyclist, race organizer, and NFL fan, concussion, safety, and inclusionary sport is a personal and professional interest. Bryan Melnyk works for the Ministry of Health as the Policy Research and Evaluation Analyst for Injury Prevention and Built Environments. In his career, he has supported wide-ranging public health initiatives in the community and clinical settings, as well as in mental health, healthy aging, child poverty, disability policy, and labor market programs. In 2011 to 2013, he led the Ministry of Health in the defense of the BC bike helmet law under a Charter of Rights and Freedoms challenge, which was won by the government. He has served on numerous local government boards for parks and recreation, planning and heritage conservation, as well as cultural organizations. He has cycled to work for 30 years and is a former youth soccer coach, first aid attendant, and ski patroller. Today, we will learn about the development of this National Concussion Awareness Initiative in BC, the BC government's commitment to concussion education, and the role of the BC Concussion Awareness Network, also known as BC CAN. Throughout the presentation, please keep your audio lines on mute. If you have any questions or comments during the presentation, please use the chat box in the toolbar below. And after the presentation, you may unmute your audio line to ask questions. And we are now over to your presentation. Sharon and Bryan, we'll pass it over to you whenever you're ready.
Thank you, Anita. I'm just going to stop my video right now because it's a little bit distracting for you guys to see me. Anyway, thank you, Anita, and thank you everybody for joining me. I know it's been a busy time, and I really appreciate you taking time out of your day. I would first like to begin by acknowledging that I am grateful to be presenting today on the territories of the Lekwungen people and the Songhees and Esquimalt First Nations. I'm also looking forward to acknowledging the first annual Truth and Reconciliation Day next Thursday. I, like others, will be reflecting on our history and what role I can play to move forward towards healing and change. But I'm here today with my colleague, Bryan Melnyk from the Ministry of Health, to tell you more about another important new recognition event, and that's the first annual BC Concussion Awareness Week. To give you a little bit of a background, I've been working at the sport branch as a senior sport consultant since 1995. As Anita referenced, my portfolio touches on a variety of areas. We are a very small but mighty branch, but my main focus is sport participation and how to make sport positive, safe, inclusive, and accessible. Today, I'm going to begin by talking about the Federal-Provincial-Territorial government mechanism, as some of you may not be familiar with how this works. And then I'll talk specifically about the FPT work group on concussion and what brought us to next week's recognition of BC Concussion Awareness Week. I'm going to be focusing more on the sport side of things, and then I'll hand it over to Bryan, who will talk about concussion from the Ministry of Health perspective, as well as some of the incredible work being done right here in BC. Next slide. As I referenced, I and my counterparts across Canada work in the areas of safe sports. In terms of our work in harassment, abuse, and discrimination, we work to provide an inclusive and positive environment in sport, free from all forms of maltreatment. In terms of injury prevention, my branch and the Ministry of Health interest is in preventing and addressing all kinds of injuries, from physical to mental. Our key sport focus, injury focus, however, in the last 5 or 10 years has been on concussion management. In terms of ethics and integrity, we work to ensure that the field of play is fair and ethical. Areas of interest include anti-doping, match fixing, and fair play. And from what I've discovered most while working in these three areas is that they often overlap. I do want to emphasize, though, that we as government can't do this alone. We rely on our partners in the sport, physical activity and recreation sectors, as well as partners in other ministries and different sectors, because they have the expertise and the networks to lead this important work. I'll just give you a few examples. Via Sport is leading the work around safe sports, that is preventing and addressing maltreatment in sport. SportMed BC and the BC Injury Research and Prevention Unit leads in injury prevention and concussion management. SportMed BC School Sports leads safety initiatives in school sports. And these and all the other partners I've showed here, they all have relationships with national, provincial, and local sport. So they are very important players in sports safety. So my role at the FPT table and through my work with other ministries such as the Ministry of Health, Education, Children and Families is that I see my role as bringing the interest of the sports sector to government and vice versa, ensuring that government's interests are well served in the sports sector. Next slide. This is the Federal-Provincial-Territorial mechanism. This is a table where FPT governments convene to discuss common issues and initiatives. Some of the examples of are the Canadian sport policy, the Let's Get Moving common vision for increasing physical activity and reducing sedentary living in Canada. That's the most mouthful. Canada Games and North American Indigenous Games, and the government's response, relief, and recovery efforts in respect to the COVID-19 pandemic. As it has been with most of you, the pandemic has been taking up a lot of our attention these days. This graphic shows the high-level reporting relationships. The top tier is a bit more complicated than what I have here, but in the interest of time and in my goal to keep you all awake, I simplified it a bit. The top tier is a jurisdictional representation of our mechanism, of our relationships. That's Sport Canada, the Public Health Agency of Canada, and the provincial and territorial branches that are responsible for sport, physical activity, and recreation. BC, we're a bit unique as sport falls under my ministry, tourism, arts, culture, and sport. Physical activity is under the Ministry of Health, and recreation crosses a number of ministries, such as ours, Health, Municipal Affairs, BC Parks, etc. And that's because recreation is so diverse. And then we have two main committees, which is in the middle here. One is the FPT Sport Committee, and the other is the FPT Physical Activity and Recreation Committee. And below that, there are a series of work groups. Most have a combination of government and non-government members, and some, like the concussion work group, report to both committees. Next slide. I won't read every name here, but this shows the depth and breadth of membership on the concussion work group. Our group includes members from government, sport, health, academia, and education sectors. Some of the names may have changed from what I have here, but I tried to include the most up-to-date list. And we'll be leaving our slides with you, so you can look at it later. Next slide. Because each jurisdiction has its own initiative and resources and unique needs, the work group is using a harmonized approach to concussion. For example, larger jurisdictions such as Ontario and Quebec have greater population bases, and as such, they have more resources. The territories and Atlantic provinces are typically rural and have fewer resources, and the rest of us are somewhere in between. So our efforts are to take advantage of common messaging, available resources, and best practices. We are focusing on these 5 areas: awareness, which includes messages for general and specific audiences; prevention, ensuring that proper measures are taken to reduce the number and severity of concussion, detection so people can recognize the signs and symptoms and manage concussion appropriately, management so that the necessary treatment is accessible and there are proper recovery protocols, surveillance to monitor and track concussion, and our key messaging, as you can see in the BC Concussion Awareness Week Toolkit, is that concussions can occur in any setting or activity, and that there are steps we can all take to prevent serious or long-term impacts. We are also taking a multi-sector approach, excuse me, because we know that people move from one setting to the next. That's from work to school to play. So we want to ensure our approach is harmonized across all settings. I want to emphasize that work in concussion didn't start and end with our work group. Governments, our stakeholders, and others have been doing and continue to do excellent work in this field. As a member of the BC Concussion Advisory Network, I'm always blown away by the amount of research, resources, and other work being done right here in BC. Next slide. I'm now going to go back a bit in time to touch on some of the key milestones for our work group as they relate to us. In 2015, our work group was formed. It's called the FPT Collaborative Work on Concussions Work Group. Our initial role was to prepare a recommendation to the FPT Sport, Physical Activity and Recreation Ministers on the development of a harmonized approach to address the issues of concussion in sport. And then once these recommendations were approved by the ministers, oversee the implementation plan. And next slide, you should be on slide 6. Okay. Quick. Okay. In 2017, the Prime Minister provided mandated direction to the Federal Minister of Health and the Minister responsible for sport to develop harmonized concussion guidelines. At that time, there was no common approach in Canada to address concussions across the many settings in which they can occur. That's including schools, fields of play, and recreation centers. So the goal was to harmonize concussion guidelines in order to provide caregivers and frontline professionals, parents, teachers, coaches, and others with consistent and evidence-based information. This was a critical first step. As you can see with our current COVID crisis, having credible, timely, easy to understand information available is incredibly important. The federal government then funded, the federal government funded Parachute Canada to lead this work. And the next milestone this year was the Governor General's We Can Do Better conference that was held at the Governor General's house. This event brought together a wide variety of disciplines and people. We had professional hockey and football players, Olympians, amateur sport groups, as well as medical experts such as Dr. Charles Taylor of the Canadian Concussion Center at Toronto Western Hospital. Ken Dryden gave the keynote address. You may recognize him as as a former Montreal Canadian goalie. He was a federal cabinet minister, and he's been a long time advocate for safety in sport. Just to note that I have put links in this document, so you can resource some of the documents that I'm referencing. Next slide. Just a second here. I'm trying to. Okay, we go. Okay. So I'm back. Could you go back to the former slide, the 2017? Sorry, that was my mistake. In mid-2017, Parachute Canada and its Concussion Expert Advisory Committee, which includes BC's own Dr. Sharon developed and released a new Canadian guideline on concussion in sport. Using the latest scientific evidence, this provided a more standardized approach to concussion, one that both the sport and medical communities have been calling for and desperately needed. This work included return to learn and return to play concussion protocols to ensure that young athletes can safely return to the classroom and to sport, physical activity, and recreation following a concussion. And then recognizing that each sport and each activity is different and have their own rules of play, equipment, and other considerations, Parachute Canada started its work with national sport organizations such as Hockey Canada, Soccer Canada, and Canadian Blind Sports, to name a few, to develop sport-specific protocols. This work took a few years. I believe as of February 2020, there are now 47 different protocols. However, if anyone has better information, please feel free to enter that into the chat box. And in 2017, the Director General of Sport Canada gave an update to the Council of Ministers of Education Canada, and this would help inform the education sector to know that these resources exist and to provide background on our workroom and provide an invitation to education to join us in our efforts. Next slide. The next slide led directly to, excuse me, the next milestone led directly to Concussion Awareness Week. In 2018-19, world and heads collided a bit, which was actually a good thing. In 2018, the federal government Standing Committee on Health established the Subcommittee on Sports-Related Concussions in Canada. This subcommittee included members of Parliament from all parties and resulted in the Tackling the Problem Head-On Sports-Related Concussions in Canada report, which was tabled in the House of Commons. Our work group presented to the subcommittee, and as a result, the recommendations in that report, such as Annual Awareness Week, was very similar to the recommendations we brought forward to the sport ministers. And in February 2019, at the Ministers' Conference, the ministers directed officials to implement within their jurisdiction by 2021 6 actions based on our recommendations. And I'll speak about those actions in a few minutes. Next slide. Our implementation plan started in February 2019 and continued through the next year. We were to report back to the ministers in August 21, but due to the pandemic, the ministers haven't been able to meet in person, but we do expect that we will be reporting to them at the 2022 Ministers' Conference that is being held in conjunction with the 2022 Niagara, Canada Summer Games. Our work, however, continues and we meet monthly. Next slide. So this is what our 6 actions are. Just in a high level, I'll go through the first one, is around raising awareness and concussion. The direction was to recognize a day coinciding with Rowan's Law Day, which is the last Wednesday in September. To provide more flexibility for jurisdictions and to broaden the scope, the ministers agreed at the 2020 Ministers' Conference to extend the recognition to a full week. BC couldn't recognize it officially last year because of the provincial election. However, Parachute Canada, Sport Canada, and others did awareness activities last year. This year, however, our province is formally recognizing BC Concussion Week with a proclamation, and this is found in the toolkit. just so you know what I'm referring to, Anita, at some point, can you enter the links to the toolkit to the in the chat box? That'd be great.
Yes, we'll do.
Okay. My minister, Melnyk, and the Health Minister Dix are the sponsoring ministers of this proclamation, and Sport Med BC, via Sport, and other members of the BC Concussion Awareness Network will be helping with social media and other activities. The second action is around dissemination of the best and most up-to-date tools, which are appropriate for each target audience. These tools are to be based upon and updated regularly according to the Canadian guideline or the international consensus statement on concussion in sport. We are incredibly lucky in BC that we have the CAT Online that does exactly that. And we have the BC CAN network and a great network of sport organizations that can help us with dissemination. The third action for each government is within the capacity of their jurisdiction. It's align policy across Canada and at all levels of sport. This is a little bit tricky as each of our jurisdictions have our own unique circumstances and resources. As well, we work in a largely volunteer-based sector, so there's limited capacity to do everything that government wants it to do. So with any policy action, we do it in full consultation with via Sport, who is our funding agency, and in consultation with the sports sector. But that's not to say that the sector is waiting for us to give them direction, because government and our partners have provided the tools and guidelines and other resources. Many are doing great work in this area. In BC, more than 41 sport organizations, including BC School Sport, BC Provincial-Football Association, BC Hockey, BC Ringette, Rugby, UBC and UVic, and others have already mandated CAT Online training. And many provincial sport organizations, particularly the contact sports, have very robust concussion management policy. The fourth action is working with our health counterparts in respect to health data and surveillance. Bryan will provide more insight into that. The fifth action is to explore the feasibility of a common data collection system on concussions or injuries in sport, and that would be in the sports sector. As I mentioned, there are challenges with this. Provincial sport organizations have different levels of sophistication, and when it comes to data collection, it can be costly and there could be some privacy issues. So what we're trying to do is find some options. We're looking at other options such as the NFL SHRED project. That's the concussion surveillance project that's collecting data at high school and community sports. And this may help us along the lines with or down the road with data collection. The final action is to require national, provincial, and territorial sport organizations to conduct a risk management analysis using a template that is provided by our work group. This assessment would be for their own use to support their prevention activities. And we are currently in the process of completing and distributing this. Next slide. So that concludes my part. I'll turn it over to Bryan now, and we'll have a question and answer opportunity as when he finishes. Feel free to jot down questions in the chat, and if I can't answer them today, Bryan and I will be sure to follow up, or you can follow up with me. Thank you.
Thanks, Sharon. I'm pleased to meet with you all today from the beautiful traditional lands of Songhees, Esquimalt, and Wasanich peoples. I'll just turn my video off here. Here in BC, BC actually, I should just say, is the only province on the FPT working group on concussion in sport that where health is a co-representative along with sport. Here in BC, the Ministry of Health recognizes how important work on concussion in sport is, but we also know that concussions occur commonly in many other settings too. Today, I want to talk to you briefly about those settings, but also about the population and public health approach to concussion. For those who work in public health, I just want to say that this may be somewhat simplified. Next slide, please. This slide depicts settings. The reality that while concussions happen to individuals, and in particular their brains, they're acquired in places or in circumstances, settings where people live, work, learn, play, and travel. They're commonly occurring, as I mentioned. Over recent years, media coverage has focused on very high-profile instances of concussion injuries among sports celebrities, and particularly professional sports, but also amateur sports where some individuals have died as a result of concussion, and rightly so. But as mentioned, concussions occur across many other settings too. So we carry this message to the FPT table, and I think we've actually helped other provinces to see and support that approach as well. What we've learned from sport concussions, and that's where a lot of the research began or was well underway, it has large application and it opens the doors to new opportunities to learn and to look for public health opportunities to improve our population's health. Much of the work in BC is led by the BC Injury Research and Prevention Unit. It's our major provincial partner in injury prevention, one that the Ministry of Health funds that both directly as well as indirectly through the PHSA. In the settings approach, we seek to understand in what situations concussions occur, the where, the when, the how, and the who. Who are these people experiencing concussions? We learn about mechanisms and the health consequences as well. Our collective focus is on what can be done to prevent them. They are preventable in all settings. Next slide, please. I've just listed a number of these settings in the following slides. And before I get into this in detail, I just want to say that the BC Injury Research and Prevention Unit has developed concussion awareness training tool that address settings. There are 7 modules for many of the settings that I'm going to describe here, and they apply to many of the actors that are involved in these settings. In the case of schools, there's parents, there's teachers, school administrators. In the case of community sport activities, there's coaches. We have a module for university athletes as well that's been developed. One as well for domestic violence, for women support workers, and one for workplaces as well that was jointly developed by BC IRPU and WorkSafe BC, that's the Workers' Compensation Board. And we also have one for medical professionals to assist them in recognizing and managing concussions and return to work, play, and learn situations. All of these modules are online and are available free of charge. They're translated into French, and they are being used across Canada now and in several other countries. So we're just very happy about that kind of uptake, very practical tools. So anyway, back to the settings. As I've mentioned, there's playgrounds and outdoor play areas, school and sport activities at recess, before and after school, but also organized sport teams that compete against other schools. Then there's community sport activities. And there's so many different sports that not just children, but youth and adults participate in. And Sharon's addressed a lot of this in her discussion earlier. We have, next slide, please. We have, in addition, the setting of home, the home setting, where intimate partner violence can occur, but also places where children and seniors can be injured, in particular falls. Seniors' falls are very common injuries among seniors. They can occur of course, at home, but also in the community and also in care facilities. And in many cases, they involve a head injury, often a concussion. I've mentioned workplace concussions. One need not think beyond construction industry. There's so many other kinds of industries where these kinds of head injuries can occur too. Next slide, please. We also know that concussions occur commonly in car crashes, remembering that concussion is a result of the jostling of the brain as a result of movement or deceleration of the head, the neck, the body, and certainly the kinds of forces that can be involved in car crashes, either direct or indirect forces, can result in concussion. We also know that concussions occur in active transportation, which is something that we're promoting quite a bit. We're also promoting safe active transportation, cycling, people that use other wheel devices, as well as pedestrians. Many people have collisions in these in active transportation that result in a concussion, but also falls, trips, and that sort of thing can happen. And just to note for cycling, wearing a helmet is important to prevent major brain injury and death, but it's not going to prevent concussion. It may help to some extent, possibly, but research shows that that concussions are not absolutely prevented by wearing helmets. Recreational falls and collisions are often places where people acquire concussions. One need think beyond extreme sports such as mountain biking, off-roading, even just regular recreational activities like skiing, snowshoeing, skating, horseback riding, diving, those kinds of things. There are other less obvious places where people can have concussions, children. Trampoline parks are particularly dangerous places for this kind of thing. Now, we've mentioned also we have a module for concussion management for healthcare providers as well. Next slide, please. I want to talk to you about the public health approach the ministry follows here. There are 4 broad categories of action that are foundational pillars of public health: promotion, prevention, protection, and surveillance. They do overlap a lot, particularly, in concussion work, we see this. I want to touch on some key public health principles and talk about the ministry's role in concussion prevention and awareness as well. For those who are not familiar with this, health promotion is about enabling people in different settings to increase control over and to improve their health by creating environments in which healthy, safe choices of people are sensible and easy to make. Health promotion involves increasing awareness and providing education, sometimes specialized education, to people in those different settings, getting them to see how concussions happen, what to look for, what to do in case of, and the importance of safe return to play, work, or learning. That's key. Our broader promotion goal is to promote a culture of safety. This involves changing social attitudes and norms and gaining their acceptance. And that's how behaviors can change. Prevention is another very broad strategy in public health. It's about taking actions that limit, reduce, or eliminate poor health outcomes. And these ones that we're talking about for concussion are brain injury, serious brain injury that leads to disability or death. Prevention also includes early detection of injury. That's a big focus of the CAT modules. We also want to prevent serious complications for those who have concussions or apparent concussions. If we see cardinal signs, we want to know that we need to take these people to emergency immediately. And so that's a big part of concussion awareness and prevention training as well. We want to prevent subsequent concussions from happening before recovery from a first is completed. Protection strategies aim at putting policies, legislation, regulations, or other controls on activities that cause injury, disability, or death. These would include removing a player from sport for assessment, knowing when it's safe to return that player back to play their sport, and learning, knowing and learning how and when to have a child return to the classroom to continue with their education. Surveillance is about getting an accurate quantitative picture of what's going on with concussions. And that means demographic trends, the distribution of injury, and mechanisms. It's about learning how our actions to promote, prevent, or protect are working as well, and whether concussion outcomes are improving. So much of this depends on having data quality, its completeness, the compilation of the data, reporting and analysis. That's the intel, that gives us the intel that we need to continuously improve in our concussion work across BC. The public health approach is also guided by some key principles as well. Next slide, please. Being thoroughly evidence-based, following the best available knowledge and being able to translate evidence into use for key audiences in these settings is very important. Being thoroughly knowledge-based, evidence-based in our prevention, protection, and surveillance as well. Following the literature, following what other jurisdictions are doing, learning from our own data as well. Another important principle in public health is having a health equity focus. Why do some groups have more concussions, poorer recovery, more disability and death? We want to learn how to address these outcome inequities in subpopulations, perhaps by having targeted tools developed, by removing barriers, improving access, closing service gaps. Of course, a lot of this depends on having data and building our surveillance, as mentioned before. This work needs to be done across the life course as well. And that's part of the issue of health equity is what age groups, what other groups, sex, gender, are most affected by this. What groups in rural and remote areas are most affected by this. Another key principle is that we collaborate on everything, working together to enhance our understanding of the problem, to plan and to implement is really important. And we strive to do this, working not only with BC Injury Research and Prevention Unit, but with the many other partners in the health sector, all the health authorities, First Nations Health Authority, Provincial Health Services Authority. This is the 21st century of government work, but it's actually a much longer standing tradition in public health, 20th century and forward way of working. Next slide, please. Our ministry has as its penultimate role stewardship of the health sector, and that includes healthcare and public health in BC. This entails having a vision and setting strategic direction, discovering what's needed and appropriate in BC, and responding to those needs through prevention and awareness activities. In BC, we have a promotion and prevention approach, whereby we focus on improving and broadening public awareness of concussion, as well as targeted awareness, education and training, the dissemination of evidence-based tools, policy changes, communications, special events, and systems level changes. This is BC's choice of approach for reducing the number of concussions that occur, their severity, disability, and death. And this is very different from the approach taken in Ontario, which is legislation driven. We do this stewardship work by funding all health authorities, agencies, including the BCRQ, setting accountabilities, and ensuring delivery that meets population health needs. We invest in research, knowledge translation, development of evidence-based tools, implementation, communication as best we can. We also invest in collaboration with our existing and ever-expanding partners and stakeholders. This includes provincial ministries. Using influence management, we seek to spread best practices in a health and all policies approach. In this approach, of course, communication and relationships are key, and that is really an aspect of collaboration. In so doing, we reach out and look for ways to address known health inequities through targeted initiatives. And to mark our achievements, we share our successes as well as keeping open to new information. BC funded and developed tools and resources are being shared and are sought after nationally and internationally. We're very happy about that. We also receive a lot of new information about leading edge research and best practices on all aspects of concussions from experts and organizations, including those represented in the rapidly growing multidisciplinary BC Concussion Advisory Network that Sharon has touched on. Next slide. For the future, we know that we need to keep up to date with research, with data, supporting surveillance, and with technology. The 2017 Concussion in Sport Working Group Consensus Statement is now ready for updating. So we are interested to follow that. We are also connected, as mentioned, with the BC Concussion Advisory Network. And just so you know, there's over 100 individuals and organizations included in this group, including top academics, neuroscientists included, and public health people, as well as practitioners and people that are interested in the topic, generally speaking, across sectors, including in sport. This Concussion Advisory Network in BC shares, as I've mentioned, leading edge research and best practices in all aspects, and is very beneficial for our work. We are also working on improving consistency and comprehensiveness of surveillance. We're hoping that we can strengthen the CAP tool for health professionals by developing with Doctors of BC a new BC guideline for primary care practitioners. This is kind of a future hope at this point. And it's also hope that we'll get a chance to look at the coding for that so that we can ensure the quality of data that's captured in primary care. We also continue to seek opportunities to develop new tools for new audiences, particularly those where there are inequities in health outcomes. Possibly older seniors or Indigenous communities are topics of interest. And of course, the ever ongoing cross-sector collaboration. It's so vital. We're looking for new partners. We're expanding on our work with existing partners. It's amazing at what new developments occur in collaboration. We're working with FBT partners on this, and I think through that work we'll probably have opportunities to perhaps work more closely with national agencies too. And we do already work with Parachute, but I think that possibly could even be expanded. In closing, I must say that it's always fascinating to work on concussion prevention. It's one of my favorite files in my role. I'm very fortunate to have the opportunity to work with, alongside partners, especially the BC IRPU. They are our expert in BC, our knowledge translator and go-get-em implementer and communicator. And I want to extend my gratitude to them, and best wishes for continued success as they take this public health approach. Thanks very much. Next slide.
Thank you, Bryan and Sharon. If you have any questions or comments, feel free to use the chat box below, or you may unmute your audio line to ask. I did see that we do have one comment come in during the presentation. I would like to mention that we will also need the ministry to focus on concussion management, since it will not be possible to completely prevent concussion. We also know that not all recover easily from concussions.
How true. It's we do our best, and I think the agencies that are working with patients on this are continuing to utilize new research and technologies in the hopes of helping people. But you're right, it's very challenging work to help severely injured people, especially.
Maybe I can ask some questions of the group if there's no other questions. Is anyone planning activities next week? And if so, can you give us a little bit of background?
This is Dr. Prutsky. I don't know if you can hear me. Thank you, Bryan, for this, and Sharon for this great presentation. So I was the one posting the comment about the management, because I work in the management aspect of youth concussion. And I think that there's still lots of work that needs to be done in especially reaching remote communities and raising awareness about the management part of more complex concussions and many of the people that are not able to access appropriate care. So that was just sort of my observation of things that we need to pay attention to in the future as well. So there's still lots of work to be done on that end, I think.
Yes, I agree. I think that rural and remote areas or industrial areas are really resource extraction areas, but also areas where people are engaging in recreational activities, and they're so far away from centers. These are risky areas, and making sure that information gets to the right hands. Yes, I can see that. Maybe I'm wondering about occupational first aid, level 3 people. I'm sure they have training in this, and how, and paramedics and other people that can assist, whether that is a group that could be looked at, as well as other people in the community, fire people, firefighting people.
I do know that Manitoba is working on a project of telehealth project with concussion in Manitoba, and I believe Nunavut, some of the Northwest some of the territory.
Yeah, that's Mike Ellis.
Yeah, and I think in our experience now with COVID, with virtual health, that may be an area to explore in the future as far as the management of concussions.
Yeah, as connectivity has increased in rural areas.
Yeah. So that actually is, it's really great you bring that up, Sharon, because I was just looking at that program by Mike Ellis, and I think one of the things that made me realize is how few patients that are from Indigenous communities or that origin actually are being served by us. And I work with more complex concussions, but this kind of telehealth service would allow people that don't have the resources to travel to access this kind of service. And I think that's a great model for BC. And in fact, he also has shown that it's cost effective and saved a lot of money for people to get on a plane and so forth. So I think that's definitely something that could be very well duplicated in BC. That's my thinking. So I'm glad you brought that up.
Yeah, no, and I know in my own personal experience of changing from my doctor, a virtual health model has been easier for both of us, actually, it's as far as time and attention.
Yeah, thank you. Great question.
We also have a comment from Joanne Sadler. Dr. Shalina Bubble will be speaking. She's our Associate Director of BCRPU. She will be speaking at the VGH Trauma Rounds, the Trauma Services Rounds on Tuesday. If you're interested, I can forward that link on or forward the pamphlet on to you if you're interested to attend. Yeah, and then here at BCRPU, Vanessa Linton is also sharing. We do have a few activities planned for the upcoming Concussion Awareness Week, specifically social media posts, billboards, and then Dr. Bubble will be doing a few presentations and she'll be doing a few media interviews. So you might be able to catch those. And then, yeah, Joanne just shared the Zoom access info if you're interested to join. That's next Tuesday, I believe.
Yeah.
Yes, Tuesday from 12 to 1. Thanks, Anita.
Yeah, the Ministry of Health is also pushing out some social media posts on Concussion Awareness Week. And we've reached out through our Healthy Communities Network, the BC Ministry of Education, and hopefully are reaching principals and superintendents. We're, of course, working through all the health authorities to ensure that they are promoting this message as well, in particular First Nations Health Authority. And we have a lot of interest being generated across government.
Okay, I'm just cognizant of time. If we have any further questions, I have Bryan and Sharon's email with me. So if you do have any questions, feel free to send them their way or send them to me and I'll forward them on. Either way, we'll try to get your answer, or try to get your question answered. But if there's no more comments, we'll sign off for today. Sharon and Bryan, do you have any closing remarks you'd like to make?
No, just in general, thank you everyone for all your work that you've been doing on this file. It's such an important one, and we look forward to working with you in the future as well.
Yes, thank you very much.